Hi, I'm Danielle O'Connor, naturopathic doctor. Today I'm going to tell you a little bit about why nutrition is so important in helping support our children with autism. We know that when children have better behavior, focus and concentration, and sleep, that they will do better in their therapy sessions and they'll progress faster with speech and language development. So behind me I have a planner which shows us the biochemistry of what's going on in our body in terms of the methylation cycle. This methylation cycle is responsible for over 200 different processes in terms of our immune system, making hormones and neurotransmitters, as well as energy production within our cells. So if you look at this pathway, we've got two main areas. This is the folate cycle and this is the methyl cycle. So folate is vitamin B9. Our body takes vitamin B9 in the form of folic acid. So folic acid is inactive or fake folate, and it converts it through the MTHFR enzyme to active folate. The only way that our body can actually get active folate is through eating leafy green vegetables. So make sure you're feeding your children lots of leafy green vegetables. In the raw form is best. Again, folic acid is fake folate and inactive. All of our grains in North America are fortified with folic acid. So pastas, breads, cereals are all fortified with folic acid. So the body has to take that fake folic acid and convert it through this enzyme in order to make active folate. The problem is in the autism population, there is often a slowdown in this MTHFR enzyme. It's around 70%. So we know that these children are going to have a difficult time converting folic acid into folate. So what's the solution to that problem? First off, like I said, is you need to ensure that your child is getting enough active folate in their diet. So green leafy vegetables is one excellent way of doing that. There are the supplements like chlorella that you can use, as well as there's an actual methyl tetrahydrofolate supplement. The other part of this is the dietary aspect. So we know if all of our grains in North America are fortified with folic acid, that means we need to take those grains out of the diet. So this is why we always suggest a paleo diet. Paleo is grain and dairy free. So the folate receptors in our body preferentially bind folic acid. So if your child is eating grains like cereal, breads, pasta, they're getting folic acid and their folate receptor sites are binding that folic acid. So when they actually do eat a leafy green vegetable, it will come in and it won't be able to bind to that folate receptor site because the folic acid is already there. This is the same thing with dairy, and there's studies on cerebral folate deficiency with dairy because the dairy will also block those folate receptor sites. So again, paleo diet is grain and dairy free. Luckily nowadays we have a lot of alternative options for dairy, almond milk, coconut milk, as well as doing a grain-free diet. They should be eating fruits, vegetables, nuts and seeds, good sources of protein, whether it be egg or meat proteins. And then you can use the dairy alternatives. This other cycle here, these two cycles go together. They're like two cogs of a wheel that need to spin together in order to make energy. So the second part is also very important. This is the methyl cycle. Okay, so this is the vitamin B12 cycle, methylcobalamin. We use vitamin B12 injections in our clinical practice. We see greater progress with our patients with the injectable form. We know that the injectable form is 100% absorbed, as opposed to if you use an oral form, is about 30% absorbed. We get our injectable vitamin B12 from a compounding pharmacy, in which case they compound using sterile techniques, and they do not add any additives or preservatives to the vitamin B12 that we use. Vitamin B12 is used 3 times a week, so we usually suggest Monday, Wednesday, Friday, just for ease of keeping track. But vitamin B12 is probably the #1 vitamin used in helping support our children with autism. So what this vitamin does is it's going to help the methylation cycle move. So again, methylation is responsible for over 200 different pathways in the body, so very important. What the methyl cycle is doing is it's taking homocysteine, and homocysteine is inflammatory, and it's converting it to methionine. Methionine is usable for those 200 different pathways. So there's 2 ways of doing that. That's through the use of methylcobalamin and the MTR enzyme, and the other way is using it through the BHMT enzyme, okay? This way it requires a couple of nutrients such as zinc, and phosphatidylcholine is very important. Phosphatidylcholine is a fat that is required for brain function and cognition, and it's found that over 85% of pregnant women are deficient in choline. So if they're already deficient in pregnancy, that fetus and that baby is not going to be getting enough choline for proper brain development and function. So we really need to make sure that we're getting choline. You can get choline through eggs if you want to make sure that there's eggs in the diet. So this is one of the other pathways that we can really get this methylation cycle moving. One of the areas here, which is the connector between the folate and methyl pathway, is MTR. This enzyme is slowed down with heavy metals. And again, we know that children with autism have higher amounts of heavy metals. So this is going to slow down these 2 cycles, as well as heavy metals will affect the CBS pathway. It's going to slow down the detoxification process in the body. So the CBS pathway is the detoxification pathway. It's responsible for getting those heavy metals out of the body, and that's why we know that there are measured higher than normal amounts in a lot of children with autism, because they don't have the capacity of actually excreting those metals properly. We also call this pathway the fat pathway. We know fats are very important for the brain, and that's why studies showed that pregnant women should be taking DHA for brain development for their baby. So there's a lot of different forms of fat. We love cod liver oil, coconut oil, DHEA, omega-3s. So this pathway is responsible for eye contact. It's also responsible for speech. So when we see speech delays, there's usually a slowdown in this pathway. Eczema, allergies, and asthma are all another part of this pathway. At the end of this CBS detoxification pathway is glutathione. Glutathione is one of the strongest antioxidants for our bodies. It's very important that our body is producing glutathione. What the CBS pathway is doing is it's actually trying to take the homocysteine, that inflammatory molecule, out of the body, but we need glutathione to do that, okay? So glutathione, we see decreased levels of glutathione in children with tics and Tourette's syndrome also. So this is that same pathway that we're looking at for helping those children out. At the one end of this pathway, we also have the Krebs cycle. So the Krebs cycle is in the mitochondria, how our body actually makes energy and ATP. So very important that we have this pathway moving so it can make that energy needed for all of the other functions in the body. And over here, we see a lot of associations with autism and chronic infections now. We're seeing more associations, unfortunately, with Lyme disease. Okay, so this is that detoxification pathway. If your child does have decreased eye contact or a speech delay, this is one of the main areas that we look at treating, okay? We're going to come over to this side. So we have your child already on a paleo diet, and then what happens is when they eat protein, the protein breaks down to amino acids. These amino acids can kind of head off into two different directions. So it can go one way into the ideal pathway, which is more of that neuroinflammatory, neurostimulated pathway. So the tryptophan will go over this way, which is not really what we want. This is an area of more oxidative stress. We want these amino acids to be producing and supporting the production of serotonin and dopamine, our neurotransmitters. So serotonin, 90 to 95% of it is produced in the digestive system. So digestion is very important because we know that there is a gut-brain connection. If your child is not having a bowel movement at least once a day, that is considered constipation. If there's any constipation or diarrhea, then the production of serotonin and dopamine is not going to be great. So dopamine, about 60% of it is produced in the digestive system. So it's really important that these kids have good digestion in order to produce those neurotransmitters. Everybody thinks of these neurotransmitters as responsible for mood, but it's much more than that. So serotonin is responsible for learning, memory, sensory issues, behavior, sleep. So the production of melatonin, right? So melatonin is produced from serotonin. And we just need to ensure that there's some cofactors in place there so that the body can actually convert the serotonin to melatonin. We have vitamin B5 and B6. Dopamine is really important for attention and focus, transitions, emotional responses, motivation, cognition, okay? So that's where we see, the children with more of the ADHD tendencies are part of this dopamine pathway. And what else is really important is the breakdown of these neurotransmitters. So one of the other things we see with children with autism is increased levels of adrenaline, that stress response. They're always in that state of fight or flight, like they're being chased by a lion. So we need to make sure that they're getting the cofactors needed to help break down these hormones. So magnesium is really important. B6 again is very important. So really what we do is we look at these biochemical pathways and we break it down by your child's needs. So if there's decreased speech or decreased eye contact, we're going to be looking at their nutrient need in this area of the biochemistry. So I hope you enjoyed my breakdown and explanation of why nutrition is so important for our children with autism. And can apply some of these principles to your child's everyday needs. Okay?